Have you woken up with an acute onset of vertigo? That can be really scary. So I will cover 3 possible causes of acute onset of vertigo in this video, along with some suggestions on what people can do. But first, I want to remind you that this is not individual medical advice. You should always talk to your own doctor for your own situation. I provide this video for informational and educational purposes only and to give you some hope. If you go to my website, betterbalanceinlife.com, you can find the original article. My preferred method of communicating is writing. That's why I wrote a book recently, as many of you know. But I understand people don't like to read and receive information by reading, like my husband, who probably never going to read my book. And so I'm providing these videos in a format that you can just watch and read along with me. So the first thing is to determine if your vertigo is an emergency. You can contact your doctor and try to get a hold of your doctor, let them know what's going on, ask them if you should go to the emergency room or to urgent care. You can just call 911. Some of my patients who've woken up with vertigo for the very first time in their life and were absolutely terrified have taken an ambulance to the emergency room. If you don't have health insurance, it's very expensive to do something like that. So just be aware of that. But you can call 911 or take an ambulance ride to the emergency room. You can get somebody to drive you. And you can also go to urgent care. However, if it is a true emergency, they're going to transport you to an emergency room, probably in an ambulance. So a lot of times if you have a vertigo emergency, the best thing to do is to go to the emergency room. So the first thing we're going to start with here is BPPV. Any of you who have watched my most popular video on this channel, which is an FAQ, why am I dizzy when I lie down and roll over in bed? You know what BPPV is. This is the ear crystals that can get dislodged at any time within one or both of your ears. And this is the most common cause of waking up with vertigo in the middle of the night or in the morning. This is a common condition where calcium carbonate crystals become dislodged and displaced inside your inner ear. Most people who wake up with vertigo in the middle of the night or in the morning have BPPV. People with acute vertigo who can find a position of relief and can still walk on their own may have BPPV. Even so, certain types, such as horizontal canal BPPV, can be so intense and severe that many patients with this condition still end up seeking emergency care in the acute stage. Like horizontal canal BPPV, when the crystals are stuck in the horizontal canal, causes what's called cupulolithiasis, and many patients with that condition, even though it's just benign crystals in the ears that are stuck in the horizontal canal, it can cause them to vomit repeatedly for a long time, and they usually can't find a good position of relief, and so they do frequently end up in the emergency room even though they have BPPV. And the purpose of that would be to get medication to suppress the nausea, to stop the vomiting, to get IV hydration, and to get some meds to suppress the acute vertigo until you can get into a specialist that can treat BPPV. So here's a clue. If you have acute vertigo, or you're researching this for a loved one who has acute vertigo, here's a clue. If you feel vertigo when you lie down, roll over, sit up in bed, get out of bed, look up, look down, or bend over, then you may have BPPV. Those are the ear crystals. You can use this blog right here to find a vertigo doctor to help you with BPPV. So this is a link to another blog I wrote at vertigodetective.com, and that helps you find a vestibular provider. It's called Finding a Vertigo Doctor. So if you have BPPV, if you think you have BPPV because you just woke up and you're spinning in the middle of the night or in the morning, as this describes, with horizontal canal cupulolithiasis being an exception, which can cause a constant vertigo. It's hard to find relief, and it can cause repeated vomiting because the crystals are stuck in the horizontal canal. With that exception aside, which has a low statistical probability that you would get that, the most common types of BPPV can cause vomiting at onset, but they may not cause vomiting at onset. And you should be able to find a position of relief if you were to sit up. And in fact, I want to show you at the end of the video my number one strategy for getting relief at home from acute vertigo. If you're looking for relief before seeking medical care, I'm going to show you at the end of the video my number one strategy. So stay tuned for that. Now, let's look at the second common type of acute onset vertigo, what that might be. I'm going to call that viral vertigo. What we technically call that in the medical world is vestibular neuritis or vestibular labyrinthitis. So right here, I differentiate those two terms. If hearing is affected by this infection in your inner ear, then the diagnosis is vestibular labyrinthitis. If hearing is not affected by the inner ear infection, then the diagnosis is vestibular neuritis. So we're going to call this viral vertigo because it's going to cover either of those two possibilities: hearing affected, aka vestibular labyrinthitis, or hearing is spared, hearing is not affected, aka vestibular neuritis. I'm going to call both of those viral vertigo. So let's take a look at this. If you have recently been exposed to a virus, then you may have viral vertigo. This condition can occur when a viral infection or even inflammation can affect your inner ear and cause acute vertigo. Common preceding viruses include COVID, herpes, like if you just got a cold sore on your lip, or you've had a persistent cold sore around your mouth, or canker sores in your mouth for days or even weeks before the vertigo started. It could be a herpes-related viral vertigo. If you had a recent stomach bug, a GI bug, an upper respiratory infection, or even a sinus infection, interestingly. That's why we don't want to let infections just hang out in our body and linger, because they can travel to the inner ear. All right, so let's take a look at how we're going to sort of differentiate the viral type of vertigo for an acute onset. If you have viral vertigo, then your acute vertigo may be continuous for 2 to 3 days. That means you could feel like a spinning feeling for 2 to 3 days. It's absolutely terrible. These folks often end up in the emergency room also for repeated vomiting, for medications to get relief, and for IV hydration because they've been throwing up for quite a while, hours to days. So acute vestibular neuritis, acute vestibular labyrinthitis, I wouldn't wish it on my worst enemy. It's absolutely terrible. The viral vertigo is not typically easily relieved regardless of which position you are in. So for the first few days, it's not positional. For the first probably 2 to 3 days, it's what's called spontaneous vertigo, meaning you just continuously spin no matter what position you're in. And that's why in these cases, it's often helpful to use medication to suppress the vertigo symptoms. Okay, so patients with viral vertigo may seek emergency care or urgent care to get medications for relief. Common medications prescribed include steroids if they think there's an inflammatory component, or antiviral medications if you've had a recent virus. Here's what I usually say. I usually advise patients to sleep for the first few days of viral vertigo. They can consult with me for a vestibular PT after the continuous acute vertigo has settled down. So it's like, just try to knock yourself out for a couple days, let your immune system work on it. And then after the third day, if they're able to move around and they're not continuously having vertigo, it's more of a trigger when they move, so it's more of a motion activated vertigo after 3 days, then we can start working on their rehab. I did write an article about viral vertigo on my other website, vertigodetective.com, if you want more information about that. I will say this: if you have an infection and you know you recently had an infection and you think now you have viral vertigo, you probably need medical management. So I would contact your primary care doctor and get medications. Like, for example, I have a patient last week that had this. She went to the doctor and they prescribed a short course of steroids as well as 2 weeks of antiviral medication. And side note, a little gem I'm going to put in here to just kind of get you thinking. The question is, why isn't your immune system defeating this virus? Why is the virus lingering in your body? If you had another virus and it's kind of hanging around and now it's infected your ear, okay, your inner ear. And so for that reason, and because of the prevalence of long COVID in so many patients now, I'm sending these folks to the lab and I'm recommending for them to get a CBC blood draw. So the CBC measures the level of blood cells in a basic lab draw, and your doctor can order this for you, a CBC, and you want to get that done before you start taking any steroids. If they give you steroids and if you decide to take steroids, you would want to get the blood draw before you take the steroids, because steroids can mess up your blood work. But the reason I want to get the CBC for people with a suspected viral vertigo onset or a lingering waxing and waning virus, which is what we see in a lot of these long COVID cases, the reason for that is because I want to see what the immune system is doing. So if they don't have enough white blood cells and their white blood cells are not elevated, then their immune system is deficient in fighting against this virus. And that might be a sign of a deeper problem. And that's, from what I'm seeing, a sign of these long haul COVID or these post-vaccination syndrome patients, and they're going to need a second protocol after they finish the initial medical management for the viral infection. They're going to typically need a second protocol of medical management to detoxify themselves from the suspected long haul COVID, which is causing them to not adequately fight the viruses that are lingering in their body. Okay, so that's a side note. But if you think you have a viral vertigo, you've got to get your doctor involved, and you probably need medical management, and you might even want to get the blood draw to see if you have an appropriate immune response. And if your CBC comes back normal, then you don't have an appropriate immune response. Your white blood cells should be elevated if you're fighting an infection. As an added bonus, when you have a viral onset of vertigo, you can also get BPPV in the same ear. Oh, it's terrible. So you might have an inflammatory or a viral issue with your ear causing a viral vertigo neuritis type presentation. And then you can also get typically posterior canal BPPV in that same ear. So as a double bonus, you could get both of the first two conditions I've now discussed in this video. And so therefore, when I see those folks, we treat the BPPV, and we also may do rehab if the viral vertigo left any vestibular damage in its wake. So if there's any leftover damage to the ear, which is called a hypofunction, after the neuritis or labyrinthitis infection clears up, then we can also do further exercises. So sometimes people with the virus might also have BPPV. It's pretty bad. They're pretty miserable. The third possible cause of an acute onset of vertigo is a stroke in the posterior fossa of the brain. This is the most dangerous cause of acute vertigo because people with a stroke in the posterior fossa may even initially have a clear CT scan at the emergency room. CT scans are notorious for having a shadow in the posterior fossa of the brain, which means that area of the brain is not imaged well on a CT scan. And that area of the brain, if there's a stroke in that area, can cause dizziness and vertigo with no other symptoms. Well, besides inability to walk, the inability to get up on their own, sit up on their own, stand up on their own, and walk on their own goes along with this. But a lot of people think that if you had a stroke, you're going to have one arm or one leg that's not working, or you're going to have slurred speech, or you're going to have a droopy face. And yes, those are all signs of stroke. But the key point here is that a stroke in the posterior fossa does not produce the paralysis or the issues with the upper arm and the lower leg, and it doesn't cause the drooping face. So this type of stroke can cause dizziness or vertigo as the only symptom. And so for that reason, one of the cardinal rules is if you cannot sit up on your own on the bed and stand up on your own and walk across the room, you should go to the emergency room, because that's one of the signs that this type of onset of vertigo could be a stroke in the posterior fossa. You should go get it checked out. And then if the CT scan at the emergency room is clear, thank God, that's wonderful. But you should still follow up with your doctor, because follow-up care is important here because of the fact that the CT scan is not the ideal way to image a brain to rule out this kind of stroke. They still use it. It's still the gold standard, but it's not the optimal imaging. The optimal imaging is a brain MRI. Patients with a stroke in the posterior fossa may have continuous acute vertigo. Typically, they will also have difficulty sitting up on their own and walking without assistance. That is one of the key differentiators. Most patients with BPPV or viral vertigo in an acute stage will feel off balance and apprehensive about falling, but they can still sit up on their own and walk on their own, even if they're afraid of falling. However, patients who cannot sit up on their own and cannot walk on their own should raise a red flag about a possible stroke in the posterior fossa. If you cannot sit up on your own or walk on your own, you should seek emergency care. Even if the CT scan at the ER is clear, a prompt follow-up with your regular doctor and most likely a neurologist may be needed to diagnose or rule out a stroke. The CT scan is notoriously limited in diagnosing this type of stroke, so an MRI or another vascular study with contrast may be superior for the diagnosis of a suspected posterior fossa stroke. In these cases, a hands-on exam by a skilled provider who specializes in dizziness or vertigo may be superior to a brain CT scan or MRI in the acute stage. The exam that the practitioner would perform is called a HINTS plus exam, HINTS plus exam. And research actually has shown that neurology residents, which are doctors in training, can learn how to do this with total efficiency, and it takes less than 5 minutes, which is why I think all emergency room doctors should be trained in this exam instead of the gold standard, which we have now, which is to rely on the CT scan when you go to the emergency room. That's a whole nother conversation we can have another time. The other two types of acute vertigo I want to mention real quick would be the sort of recurrent chronic conditions, the Meniere's type attacks, and vestibular migraines. Those can both cause acute vertigo. So if you have been diagnosed with Meniere's or diagnosed with vestibular migraines, hopefully you have medication that you could take if you do wake up with a new attack or if you get hit with an attack at all in the middle of the day. Now, as promised, I want to tell you my number one trick for acute vertigo, and you can find it if you go to vertigodetective.com and go to the article called Home Remedies, which you could find by going right over here into the search and typing in the word remedies and then hitting the search right there. The number one thing I do and recommend to my patients with acute vertigo is cool off the room and put ice on the back of their neck. So if you can cool off the room to the point where you're literally cold and you need a blanket, and so crank up the AC or whatever you need to do to cool it off, and I like to put ice on the back of the neck, like a bag of corn, a bag of peas, if you have, with a paper towel to protect the skin, or if you have a nice cervical ice pack, you can put that on. And cooling off the person with acute vertigo can help to reduce the intensity of the acute vertigo. And then you've got to figure out next steps. What are you going to do? You're going to go to the emergency room. You're going to go to the urgent care. You're going to manage it at home with medications because maybe you've been down this road before. You're going to call the primary care doctor and get medications prescribed, go pick them up. So it's up to you how you want to handle it, but I'm really hoping that this video on the most common causes of acute vertigo was helpful, and God bless.